Okay, well, thank you very much for agreeing to speak to us at the ILPN, and we're here at the Transforming Care Conference, enjoying the beautiful sunshine in Milan. And if you could introduce yourself, please.
Yes, my name is Peteke Feijten and I work in the Netherlands, in the Netherlands Institute for Social Research. We have different departments and I'm in the care department. We mainly study long-term care, so it's for community dwelling people and people living in institutions.
Okay, and if you could explain what you are doing for a layperson to understand.
Yes, I can. My main research is related to the Social Support Act. It was introduced in 2007 in the Netherlands. And for the Ministry of Health and Welfare, we are evaluating this act. And in this act, policy making is decentralized towards local authorities, local councils. So we are studying how they implement it and how that works out for people who use the type of care support.
Okay, and using what kind of data or what kind of methods?
We collect data ourselves. Part of the data is quantitative, so we collect it by way of surveys, we use registration data, and part of the research is qualitative, so we do interviews, focus groups, observation, well not so much observation, and I myself, I'm mainly a quantitative researcher, so I analyze survey data, and I specialize in the bit where we interview people in municipalities, dwelling people, who have applied for social support at their municipality, and we have asked them about how that application went, what kind of contact they had with their local council, if they got any support, and yes, if so, what kind of support. And also the outcomes in terms of how they manage with help of that support, how they can participate in society, if they're self-reliant, if they have any feelings of loneliness, that kind of outcomes.
Okay, thank you. And how would you describe the long-term care system in your country?
The long-term care system is basically split in three bits. One bit is the health insurance, and there's one bit of care in the health insurance, and that's nursing care for people living at home. And then there's a bit of social support, so people living at home needing support to participate and develop at home independently. And the third bit is for people with permanent severe disabilities that cannot live at home and live in institutions. So that's the frail old and people with severe physical or mental disabilities.
And the system is funded by a combination of insurance and other things?
Yes. So the first of the three that I described, it goes via personal insurance, but it's obligatory, so everybody has to take this insurance and pay for it a monthly fee. And the other two schemes, so social support scheme and the long-term institutional care scheme, they are financed by the state. And the long-term institutional care implementation is also done from on national level, and the social support bit is decentralized to the municipalities. Those municipalities get their money from the national budget.
The national budget. Okay. Okay. Great. And what would you say are the three main policy priorities for long-term care in the Netherlands?
Well, the first one, like I suppose in many other countries, is affordability, because the costs of care are increasing at a higher rate than the GDP. So the national government really wants to curb that growth of impost in many ways. So that's one policy priority. Second one is access to care, especially the long-term institutional care. It has really been narrowed down, so it's really only there for the people who really need it. Whereas in the past it was a bit more easy to get access to it. So it means people have to stay living at home for longer with moderate to severe disabilities, just as long as they can. And people feel that there's a big difference that's maybe unfair or not.
Okay.
So that was the second, and the third is quality. That's also an issue, especially quality of care in the institutions. Especially in the media, there are many stories again and again of people receiving very poor quality of care. Our research shows that it's definitely not true everywhere. But in an ideal world, you would want the quality to be perfect everywhere, of course, because it's about our parents and grandparents. They deserve good quality care, and it's not the quality it varies between institutions. So improving quality to a high standard everywhere. That's one policy priority as well.
Okay, and would you say the priorities have changed in the last 5 years at all?
Yes, we can definitely say that, because this system of the three parts, kinds of support, it has been implemented since 2015, so about 2.5 years ago.
What was the name of the legislation?
There have been a lot of changes. So that Social Support Act that we are studying, it was renewed in 2015. It already existed before that time.
Oh, right.
But that bit for institutional care is now called the Longterm Care Act, and that one is new and quite strict in its when people are eligible to get access to it. So yeah, there have been big changes, and also budget cuts for social support. So people who received home care, many of them, their hours have been reduced. It's harder to get access to certain types of care. People living at home as well. So those changes are really being felt.
Okay, and if you had an opportunity to introduce one policy in this area, what would you like to see?
I think what we see in our own research and research by others is that with the introduction of this new system since 2015, that there's a care gap between the social support for people living at home and people being eligible for living in an institution. But there's some kind of acute care provision missing. So, for example, when someone living at home break their hip or something, they go to the hospital, they get an operation and go back. They have to go back home because they're not eligible for living permanently in the institution. So there should be some acute care recovery provision for those people before they can go home, as a kind of in-between solution. And there is there is a thing like that, but the capacity is too low. So I think it should be prioritized to get that.
Sure. Thank you for explaining that. And if you could do one piece of research in the future, what would you like to do if you didn't have to worry about the resources?
All right, yes. I think I would like to do a research. Well, we have to try to do a research like that, but it's quite difficult. I won't explain why, but it would be nice if we could do a research on people living in different municipalities, so under different support regimes, if their outcomes differ a lot, and when outcomes do differ, so if people in one municipality are much more self-reliant or can participate in society much more, if that is due to their own characteristics or if it's due to the way the care is organized, the support is organized in their municipality. It would shed a great light on that bit.
And okay, if you could answer these quick questions with a number where 1 is low and 10 is high, rating the different themes and issues according to your opinion. What priority in the context of general policy is given to long-term care in your country?
6-7.
Okay. And in terms of the awareness, what a number between 1 and 10 for the awareness of the public about the long-term care system, what it gives to them, what it can give to them?
Ooh, that would be between 8 and 9. I think that's quite important to them.
There's a good level of awareness.
Of how the situation is, or how they think the situation is.
Just awareness of the existence of social care, I guess.
All right. Well, I would say an 8 in general, but some groups are exceptions.
Okay. And how well do you think the system supports people with care and support needs?
Well,
it's difficult
I'm a
to
bit
generalize
more
it.
critical about that.
Okay.
Maybe a 7, a 6.
And what about the support given to family carers?
Well, I would say a 6, but it's. I know that there is a lot of support out there, but somehow people don't find their way to this kind of support. That's probably the biggest problem. So their awareness is a problem, I think. So yeah, overall a 6.
How well would you say the services of health and social care are integrated?
Health and social, not that well, no. 5 or 6, somewhere in between. 5 and 6.
Okay. Are there any particular aspects where those two pieces could join up in the jigsaw?
Well, yeah, I know the general practitioners are a real key person, but they don't get the time or the money to be involved in care issues. Their main priorities are medical care, not social care, but they do get a lot of their patients who they see that they need social care, but they don't have the resources or knowledge or the time to give them that social care. So yeah, there's definitely a world to be won. Yeah.
Okay. Okay, well, thank you very much for your time, Peteke.
You're welcome.